Alrighty, good morning, everyone. Those that are here, those that may be watching the live stream, or those watching a recorded version at a later date. This is our regular BOCC meeting for April 24th, 2024. Before we call the roll, I'd like to invite Elder Dave from Sun Country Church up to provide the invocation and lead us in the pledge. Dave, the floor is yours.
Thank you. Father in heaven, we thank you and we praise you, Lord, for this time together. Lord, your word says that if we seek your face, Lord, you will help us, guide us, direct us, Lord, and order our footsteps as we go through this time together. Lord, I ask your anointing upon each and every leader here, Lord. I ask, Father, that you give them wisdom, understanding, guidance, and direction, Father, in all aspects. Lord, you said that if the nation seeks your face, you will hear from heaven and heal their land. Lord, it starts here. It starts right now. Lord, I just ask your blessing upon this meeting. Lord, I just ask that your will be done above all things. In the name of the Lord Jesus Christ, Father in heaven, we pray. Amen.
You could join me in the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, sir. That may have been me, but it's quieter in here. So with that in the background, Emily, could you call the roll, please?
Commissioner Thayer?
Here.
Commissioner Richardson?
Here.
Commissioner Schroeder?
Here.
All righty, we have a quorum. First item of business we have is approval of the agenda before us. I'd accept a motion.
Mr. Chairman, I move that we approve the agenda as presented.
Second.
Okay, we have a motion and a second to approve the agenda as presented. All in favor, please say aye.
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 Aye. Motion carries, so the agenda is adopted. First items of business we have are the items on consent. I would accept a motion.
Mr. Chair, I make a motion that we approve the consent agenda items as presented.
Second.
A motion and a second to approve the items on consent. All in favor, please say aye.
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 Aye. Okay, the consent items are adopted. Elected officials, department head, staff reports. Do we have? Yeah, thank you.
Rhonda Braun, Elbert County Clerk and Recorder. I had a couple of things. We now have fraud alert notifications live in recording, so residents can go in and sign up with their email and their name, and they'll receive an alert whenever documents are recorded using their personal or property information. So we're excited to announce that. And in the election side, at the moment, we have Clear Ballot confirmed to come in and do a workshop May 15th at 10 a.m. We have talked to Dominion, and we have them slated for 1 p.m. on the same day. We have not confirmed that. The contract for our voting system will be up at the end of this year, and we will need to either renew our contract with Dominion or get a contract with Clear Ballot. Those are the only two approved systems with the Secretary of State's office.
Sherry, anything? Yeah, thank you.
Good morning, everyone. Sherry Hewlett, the Elbert County Treasurer and Public Trustee. You have before you the Public Trustee First Quarter 2024 report. Nothing earth-shattering from this time last year. Releases are way down, as you can see. About 800 or so down from this time last year. Foreclosures this year, as of this report, we had 6. Currently, we have 8, and I have 1 waiting to be reviewed. So we're staying about the same as we did last year on new foreclosures. But the good news is what you can see on the report is most of them get withdrawn. We only had 2 sales this time last year in the first quarter, and we've had none this year. So that's a good thing. property owners are finding a way to get either caught up on their payments or working with their mortgage company to get those withdrawn. But I just wanted to say I don't foresee anything, a big jump in the future. Who knows? I can't predict the future, but so far so good there. As far as the treasure side is concerned, we're still real busy. I think we're probably close to 50% collected. Full payment deadline, our second deadline is April 30th, so that's next week. And then June 15th, we'll collect the second half. So we're just busy collecting property taxes and whatever else we do over there. So business as usual and just staying pretty busy. Do you have any questions on the public trustee report?
I do not. Do we have any questions? No, thank you so much.
And the good news for me anyway, and for us, is that at least I'm making the fees that I need to fund that office. There are a lot of counties in Colorado that are not able to do that. There's legislation out there currently to try to get some of the public trustee fees increased so that it doesn't matter if you have 1, 2, or 4 or 200 foreclosures, you still have to do the work. So anyway, fortunately in Elbert County, we're maintaining and able to transfer a little bit of money to the general fund at the end of the year. So, okay, thank you.
Thank you. Any other staff input at this point? Okay, nope. All righty, so as has been our practice for this 150th anniversary year, we've got a little tidbit from this time 150 years ago in our county, from the county records and previous minutes. This is from April 1874, and actually the territory of Colorado in the county of Bent, which was partially brought into Elbert County when it was formed. But on April 6, 1874, the county commissioners of Elbert County and Bent County met for the purpose of settling matters on account of Greenwood County. The two Board of County Commissioners agreed to settle matters as follows. Each county to assume assets and liabilities in proportion to the amount of property that each county received from Greenwood County. It was further agreed that the proportion of each would be the following. Bent County assumes 4/5 of the assets and liabilities, and Elbert County assumed 1/5 of the assets and liabilities of Greenwood County. It was estimated that the amount of Greenwood County orders outstanding was $2,000. The Elbert County's proportion would be $400, and Bent County's proportion would be $1,500, or $1,600, excuse me. The Elbert County would receive credit on account of assets as follows. Credit of account of $100 for the sale of a safe, credit on the account of $30 for buildings, and credit of account of $8.40 for books, leaving a balance due from Elbert County of $261.60. And I'm sure they've eventually paid that. April 9th, the county commissioners of Elbert and Bent met again to discuss an amendment to the agreement regarding the proportions of the county's indebtedness. Elbert County would stand on the basis of the first agreement, that is 1/5. It was then agreed that Bent County call in all the Greenwood County script. They had issued certificates of finance at the end of the year, and that Elbert County have one final settlement with the county of Bent. Elbert County then gets a credit and an order for proportion of the school money, now in the hands of the former treasurer of school district number 1 of Greenwood County, and the total amount of that was $265.48. So it looks like they came out about $3.12 to the good on between those two actions. So that was what was all the rage 150 years ago in the counties of Elbert and Bent. We talk about money a little bit here too. Moving on, we'll open for public comment at this time. Do we have anybody in the room that wanted to make public comment? Robert?
Good morning, Commissioners. Thank you for the opportunity. I'm Name is Robert Rowland, 1891 Pawnee Parkway, Elizabeth, Colorado. And probably no surprise, I'm here to talk to a water issue this morning. And I'll be brief and keep it to the point. I did and do have for the county commissioners a packet that I also gave to your clerk, if I may approach.
Oh, yeah, please.
Allow me to keep my comments brief. In 2015, the county was able to secure a program and contract with the USGS we'll call the Water Monitoring Program. The initial program was set up to have 40 wells in different portions of the county and in each of the 4 aquifers in the Denver Basin, monitored and tested on a regular basis. And it's been done that way since March of 2015, every other month. As an example, my well is on one of those test wells. And I personally have kept track of that. And the reason I show that is because I want to talk about the relevance of the continuity of this program. It tests the water levels, the static levels in each of those wells each month for the purpose of monitoring the water and keeping track on the health and availability of our aquifers, particularly on individual wells. We all know about the impacts and the concerns and the growing issue of growth in our county and what, if any, that impact might be. In September of last year, the last well testing monitoring test by the USGS was done. 2 of the representatives and the field representatives told us that this program was being, and I'll use the word suspended, whether that's the appropriate term or not, I'm not sure, but the program was being suspended at that point to allow for the USGS to compile a summary of data of all the wells in the program for the past 8 or 9 years. It's been done now for 9 years. I've been curious and wondering, and some of us have been asking, why that program was suspended to do an analysis of 40 wells for data that is already on the USGS website in the Department of Natural Resources that, quite frankly, we have a list of and have access to under that open, public documents. And it just didn't seem to add up that it would take 8 months now and ongoing still to compile the data that we could literally do in probably 2 days. Maybe not to the extent or with all the fancy. So anyway, the thing I have here is a open records request that I've given to the county to formalize the questions and the responses and the documents that we would like to have to understand why it's been either suspended and what the current status and what the future plans for that program are. Thank you.
Thank you, Robert. Do we have anybody else that wanted to make public comment in the room? Okay. Seeing none, we'll close public comment in the room. And apologize, I had a document that was emailed to us, and we'll respond in a moment, but had a document that was emailed to us earlier in the week, that a request from a citizen to read a public letter. Quite a bit of it referenced an application that has been made formally that we can't discuss outside of that public hearing. So I'm not going to read that letter today, but it did kind of highlight a practice that probably we need to relook, which during COVID, when folks were uncomfortable coming out in public, even though we were great people, we allowed folks to submit emails to be read as public comment or requests that they be called at their homes to make public comment during the meeting from their location. I think during those many years, I think we made perhaps 2 phone calls, and we've received 3 or 4 letters during that time. But recognizing now that potentially those letters could bring in issues that shouldn't be talked about outside of public hearing, I'd recommend that we stop that practice. If somebody wants to show up and they're talking, we can stop them if they stray off topic, if they've presented material outside of a hearing that belongs in a hearing. It's a little harder to backtrack once we've received emails. Those can be forwarded to staff and made part of the record for the future. But since it was very rarely used throughout the years, I think it's probably best just to not put ourselves in any legal jeopardy by taking what could be ex parte testimony outside of an actual hearing. So if you're okay with that, we'll probably proceed with that. But before we close public comment, Robert, thank you for bringing that information. To my knowledge, the contract's still in place. In fact, I think in the last week or two, we received a bill from USGS. I didn't look at it in detail, as you know. It came to me as the chair. I put it in finance's box to pay, but we'll follow up on the records request, because I agree there's monitoring versus writing reports are probably two separate activities that maybe there's only one person assigned to do them and can't do both, but I think we all find a way to do a lot of stuff at the same time, so thank you for that. And so with that, I'd close public hearing, and I think take a very brief recess, because the next item we have up is our quarterly Board of Health meeting and probably some computers that need to be switched over. Alrighty, I guess 5 minutes wasn't required, so it's 9:19 and we're back in session. I would accept a motion to open as a Board of Health.
Mr. Chairman, I move that we open the Board of Health presentation.
Second.
Okay, we have a motion and a second to open as a Board of Health. I'm not sure if we need it, but Emily, could you call the roll just to make sure the whole Board of Health is here?
Commissioner Thayer? Here. Commissioner Richardson?
Here.
Commissioner Schroeder?
Here.
Here. We have a quorum of the Board of Health. So, Dwayne, I'll pass the floor to you. Thank you.
Thank you, Commissioner. Good morning, Commissioner, guests, and citizens listening in. Before I get started, I want to recognize John Hill for his work in covering local high school athletics. If you read Ranchland News, it's obvious that John does a lot of driving in between contests and performing arts, and that is a part of the connectivity that we're trying to encourage folks to engage in. Connecting with neighbors, family, friends is an important component of our individual and collective mental health. So thank you, John, for all the miles you're driving and the coverage and pictures you're taking.
And John, if you need the correct spelling of your name, Dwayne will talk to you afterwards. Thank you. Thanks for what you do.
Commissioners, the slide deck I'm going to go through was updated again this morning. So not dramatically. I think I added one slide for a report that came out yesterday from the federal government. I'm not going to focus too much on the process numbers. Those are self-explanatory. Just try to hit the major highlights of what's going on. So staffing updates. You are most likely aware that our Public Health Emergency Preparedness Coordinator role has transitioned to the Office of Emergency Management to support them and backfill some needs there. That position was created last year through 2 grant opportunities. One is the City's Readiness Initiative, and the other is an emergency preparedness grant through the state. Because those grants must go directly to a local public health agency and cannot go, for example, directly to emergency management office, we will be the contractor. We will be the recipient, primary contractor, then we'll subcontract the scope of work out with our local OEM. You can see the breakdown of our 50% contribution for that role. The other 50% is coming from the OEM budget. We just submitted the FEP grant the other day, and because last year's allocation was committed entirely to the FEP role, we have some additional funds beyond our commitment to OEM. So we're going to transition Lisa Helseth, our health educator, to 30% of her time on the public health emergency preparedness deliverables. And as a refresher, that is primarily emergency support function 8, which includes, the easiest way to explain it is if we have another outbreak of communicable disease of any kind, that role will monitor daily the reports from the state, and that's everything from an infectious disease notification, a dog bite, another animal bite, basically anything that might be circulating in the community. So that role would then follow up. For example, if there's a dog bite, those are required to be reported, and we want to know all that we can about that dog bite, but primarily, has that dog been vaccinated against rabies, and so on and so forth. Where did the bite occur? A lot of our dog bites may come as a surprise or may not, are the owner's dog, where two dogs get tangled up on a walk and owners are trying to separate them. So a lot of times it's a very isolated incident as opposed to a dog running wild that has no owner, and so on and so forth. The other thing I want to touch on is our budget. It's important that I share that in light of a recent review of where we are with our budget, we have been utilizing our fund balance to cover expenses. We're looking at what our options are beyond this calendar year, this fiscal year, 2024. Once we have the findings, the results of the audit that's currently being conducted, we'll have a better understanding of if we are to maintain our current staffing level and our current offering of programs and services, how much external money do we need to come up with in grants or revenue from consumer services, which is largely revenue from on-site wastewater treatment systems or septic fees, and restaurant licenses, childcare licenses, and so on and so forth. So I think I mentioned last quarter we took a significant hit in 2023 due to higher interest rates and fewer housing starts, and people putting in septics, as well as the rain and flooding in June that kind of ground our inspections to a halt because nobody was putting in anything, laying any foundations. So okay, moving on to our payer mix. So I had the good fortune to sit at a table at a meeting, a lunch table at a meeting with one of the vice presidents from the Colorado Rural Health Center. And I said, I need some data. So why is this pie graph important? In our pursuit of, or I should say exploration, assessment of becoming a designated rural health center, the accepted breakover on whether or not the juice is worth the squeeze in the finances, on whether you should pursue rural health center status, is 50% of your payer mix needs to come from Medicaid or Medicare clients. So if you look at the pie graph, 31% Medicare plus 19% Medicaid is exactly 50%. So I was hoping it would be a little bit more weighted, a little higher weighted in that. So we will continue to explore this and continue to monitor the data. Given the significant lift that it would take to become a designated rural health center, and mainly that is policy, procedure, things like chart review, patient chart review from our medical officer and things like that. At this point, I don't feel like the juice is worth the squeeze. So in other words, for the extra percentage bump in reimbursements we would get from payers, balanced against our costs and our overhead, I don't know that it would be a financially viable option at this point. We'll continue to monitor. This may change. Who knows what the economy is going to do, in the years to come. So just wanted to share an update on that. The clinic numbers, you can read through. Generally speaking, for the first quarter, our visits are down. So you can see the monthly visits there versus 2023 visits. And our revenue in Q1 is down. So what does this mean? When we initially received the workforce development funding that pays for the salaries for our nurse practitioners, our medical providers, my thinking was always, we've got 2 years worth of funding, we've got 2 years to demonstrate a need for a primary care and sick care clinic. If at the end of this assessment period, at the end of a couple years, we see it's not a viable option, we'll need to look at dialing back some of those services. We can only put the service out there, put the resources out there. If it's of value to the community will come and avail themselves of the services and resources. So as long as we have external funding to support it, we can continue it. And again, we just need to break even because we don't have a mortgage to pay or things like that.
Have you looked at, where is your client base drawn from? Is it primarily local to the Kiowa area and folks are choosing?
I'm going to defer to Sarah. Do you see most folks coming?
A little bit of everywhere.
Okay, so it is, I know the numbers are kind of small to really do analysis on, but is your gut feeling it's broadly used throughout the county? Oh.
Well, the big thing is a lot of people still don't really exist. So our big focus right now is connect marketing.
Yeah.
To try to drive some of that up and to announce here just while everybody's listening. We are having an open house on May 13th.
Wonderful.
I'll slide on that.
Yes.
All right.
Perfect.
And John is writing, so hopefully we'll get. Yeah. Okay, thank you.
So on the clinic revenue slide, you can see that between United and CMS, Medicaid, Medicare, those are our most prominent drivers of utilization. So I anticipate that once more folks realize what services we can provide, that the Medicaid and Medicare will climb, but we have to demonstrate proof of concept for that. Okay, so clinic services beginning this quarter. Fluoride varnish. So during the pandemic, a lot of children and adults probably went extended periods without seeing their dental provider. The fluoride varnish, varnish is kind of a harsh word, but that's what the verbiage dentists use. It's basically painting fluoride on teeth. It can be done as frequently as quarterly. Our cost is nominal. I think our cost for the individual fluoride packet is less than $2. So that's something that has a significant potential for preventing cavities among children and adults. Cavities frequently lead to other health problems. A lot of health problems start in other parts of the body start with poor oral health. So the other service that will begin, our family nurse practitioner is taking her Federal Motor Vehicle Carrier Safety Administration medical examiner test/exam next week. So, assuming she passes, we'll be able to offer that. We frequently refer to as a commercial driver license
CDL.
exam that's required. So this is both for a convenience for our internal folks in Road and Bridge to where they don't have to go outside the county, and also for any bus drivers in the school districts or Burnco or whoever else needs that. And I think, Sarah, is it good for 2 years? Is that right? It depends on the certification. Depends, okay.
Admit when I first saw the slide and saw medical examiners usually has a different meaning to folks.
Yep. Yeah, just clarifying, but this is a different exam. Our team is going to go to Simla High School in June to do the sports physicals. For $20 per student, that's as low a cost as you'll find, and we will not turn anyone away for lack of ability to, for the family to cover that $20. So we can go to any school. We could go to the rec department. We just have to be invited to offer this and make it convenient for the school student athletes. As Sarah mentioned, this is our open house, trying to get the word out on what our capabilities are, that you don't have to go outside the county to get simple diagnostics, simple lab work. You can talk with our pediatric NP, our family NP, and learn about the convenience. Primary care close to home is what we say. So. Environmental health updates, those are self-explanatory. And our septic inspections, a little bit behind. The first quarter is always iffy with the weather, so. Our vital records continue to grow, our issuance, and our revenue accordingly. Okay, our health promotion updates. We are joined today by Jenny Fisher from Douglas County Health Department. Jenny, will you stand up and wave, please? Jenny is the tobacco educator. By way of a brief overview, every pack or carton of tobacco that's sold in Colorado has a tax on it. Part of that tax funds tobacco cessation and prevention education. Local health departments apply for that funding. Because we could not sustain or really keep busy, given our small population, a full-time tobacco educator, we are partnering with Douglas County Health Department. They receive the funds allocated to Elbert County, and they do the work in collaboration with us. So Jenny has been working with Lisa Helseth, our health educator, to make rounds around the county with the schools and the rec department and other locations, teeing up this work. I'll skip to our blood drive. I think we had our most successful blood drive. When was that? Last January or? April 10th. April, okay. Nearly all the slots were full, so we appreciate everyone that came out and donated. Health screenings at the fair. So we've been kicking around for the last couple summers what we could do at the fair, and with the dissolution of the 365 Health Fair, our local county fair seemed like the logical next step to just replace that, the 365 Health Fair with a local event. And this will be the last Saturday of the fair. More to come on this, but just wanted to tee that up because I think our next board meeting is probably during fair.
Be conducting this at your facility, or?
We're going to be
booth at the
in the
fair?
Ag Building.
Oh, okay.
I think in the
So you'll be a
conference
booth-
room. Conference
okay.
room at the Ag Building. Yep. Just teeing up, coming later this year. So we have had an initial meeting with, and I probably won't get his title right, the CSU Extension Rural Outreach Coordinator, not through our local county extension, but through, he serves at 10 County, Northeast Colorado. And he is helping us connect with the Coffee Break Project that was initiated in Rocky Ford in Otero County. And this is an opportunity, again, for connectivity for anyone that wants to come, have coffee, talk about whatever's on their mind. The Rocky Ford project focused on ranchers, felt like a good opportunity to replicate that here in our community, but it's not necessarily exclusive to ranchers. Anyone can come. We just want to have folks talk about something that they want to talk about. So we are trying to coordinate a visit to Rocky Ford. They actually meet twice a week. I think they meet Mondays and Wednesdays every week. Coffee and donuts, and they probably have their space available for probably 3 hours, so folks can come in as they please. Just yesterday, so this was an added slide, the federal government came out with a national strategy for suicide prevention. You may be aware that this past quarter we have had a disproportionate number of deaths by suicide. I believe there was 5 in March in a period of probably 2 weeks. So the strategies are going to emphasize the 988 suicide and crisis line, health equity, the intersection of suicide and substance use, youth and social media, and lethal means safety. So we won't dive into all of these, but certainly we'll continue, and we have been for a couple years now, promoting the Suicide and Crisis Lifeline, as well as other state resources. Our county attorney has done an initial review of our Credible Mind behavioral health platform, the contract for that. We need to tidy up some verbiage in there or eliminate some verbiage that we don't want in there. Hopefully we will launch that, and I may have put that, no. Hopefully we'll launch that, well, we will launch that sometime later this year. The youth and social media, that is obviously a hot button topic, and we'll delve a little bit into that as time goes by. And more to come on this. This is a 10-year approach to address gaps in suicide prevention. The QR code there, folks can scan that and it'll go straight to the national strategy. Okay, our community health improvement plan. So looking at our overarching goals, and I should mention this plan is going to be backdated somewhat to 2023, so it'd be 2023 to 2027. I didn't feel too bad about that because I think one of the state's health improvement plans was backdated by 2 years. So if we're only backdating by 1 year, I think we're fine.
Already half completed, huh?
Well, and I felt like we should get credit for the things we've already done. So with the primary care clinic, and you know, it's really hard to kind of upset the apple cart in the care delivery model that has been prevalent over the last decade plus, which is to say our broken healthcare system. So again, we want to emphasize that we can take care of probably 80% of folks' needs and ailments locally through our nurse practitioners and at a lower cost and in a more convenient fashion. Our behavioral health, this is an issue that will probably take a generation or more to really demonstrate meaningful impact. This is not something we're going to flip the script on in 3 to 5 years. We'll continue to push out resources. If we could somehow identify a windfall through a foundation grant, I mean, what we really need is more providers, more behavioral health providers in the county. A lot of that need, I think, can be provided through telehealth, but there's I'll just say a significant amount of coordination with the telehealth and the rules and regs with that. So we're continuing every month to try to chip away at opportunities for improving access to counselors, behavioral health resources, and so on. And then healthy aging. Everyone is aware that our population is a little bit older than the state mean, so we want to continue to support and enhance opportunities for older adults to age in place where they want to. If that's their home, so be it. And the strategies to support those goals, as I mentioned, establishing a primary care clinic, the lab services, the immunization. Prospectively, we want to offer family planning. With behavioral health, the stigma, the destigmatization on the behavioral health conversation is super, super challenging. I think I've said before, folks in rural communities don't like to talk about it. We've got to get past that. We've got to normalize those conversations in a proactive manner. And again, we can put that information out there, but we need the community to really embrace and avail themselves of the resources. And veteran engagement as well is an area we need to delve into, given our better than 9%, I think, of the population that has veteran status. On the healthy aging, I'd like to establish a senior falls prevention program. Older adults that fall, if they break their hip, they are very debilitating and quite often fatal within a couple years due to their lack of ability. It just has a cascade effect when you're not mobile and you can't feed yourself and your nutrition wanes and so on and so forth. And we also want to address the social connections and reducing isolation through whatever means we can, including the coffee shop project. This is also a focus of several projects, including the Eastern Colorado chapter of the Area Health Education Consortium. And we are engaged with several rural and Eastern Colorado groups that are working on this. I want to remind anyone listening that has a high school senior graduating that we have the scholarship opportunity. This is money for the asking. We'll award one $500 award, but we need the applications in by May 15th. And reminding folks about how to report a public health concern. Our most current one is the discharge of effluent from a septic tank. That's kind of a back and forth between neighbors. So we can step in where regulations allow us, but sometimes it gets down to being good neighbors. So there's our contact information, and that's all I have. So happy to entertain questions.
Thank you, Dwayne. Do we have any questions or comments? Nope, good update. No questions. Much appreciated, and probably once we have the audit in, we probably need to sit down and just kind of have a workshop over funding. And you're providing great services yourself, your staff, and if there's a way to continue and grow that, I think that's obviously good for the community. So, thank you.
Thank you.
With that, I'd accept a motion to close as Board of Health and reopen as Board of County Commissioners.
Mr. Chair, I'd like to make a motion. We close the Board of Health and open as county commissioners.
Second.
Okay, a motion and a second to close the Board of Health and reopen as the Board of County Commissioners. I'll note that the three of us are still here. So, all right, moving on to discussion items. Sean, where are we at with our Veteran Service Officer position?
So right now we are working with El Paso County on meeting the needs, as we do not have Rick Morgan in the position anymore. We're taking our time selecting the right candidate, because obviously Mr. Morgan had been in the position for like 25, 26 years. We've received a lot of interest and have started to kind of review the applicants, and we're at the point now we'll start interviewing soon.
And are we viewing this now as a full-time position, or is that still?
I think it depends on the applicant. A number of them already have other positions.
Okay.
So if they want to take on the position, if they're selected part-time, that would be fantastic. But once they get in the position and start assessing the needs of the county, then we'll know if this is going to be needed to be full-time or not. Okay. But first, even to do that, we got to get them trained. There's a lot of training involved.
Understood. Any questions on this one, Sean? All righty, thank you. Rhonda, at the last meeting we had a proposal for a ballot measure to extend term limits for some of the electeds to 3 terms, and you were looking at the cost of that. So what did you find?
Yes, Rhonda Brown, Elbert County Clerk and Recorder. The question to put, as you know, to put a ballot measure on in a county can only come from the county commissioners. There's no initiative process for citizens to gather signatures like they can in a municipality or a state. So the county commissioners would be the ones that would have to put that on. For a question to be on the ballot, just kind of looking at what we've done in the past, would be approximately 80 cents for each active voter, at a cost of $18,080 for one ballot question. As of right now, the cost varies on active voter count, how many entities are sharing the cost. So if we have a whole bunch of people sharing the cost, it would be less. There is a small charge for more than one question if you choose to do that. And this is not a Tabor question, it is not a tax question, but should you, just to throw in there while we're having the discussion, should you have a Tabor question, that would also include the costs, the direct costs of the mailings, because we're required to send out, like the Blue Book, we're required to send out a Tabor notice with that. So should there be another question, that would just, those are direct pass-through costs. Ballot certification is September 6th, so that's, we need stuff before then, obviously. but that's a drop-dead deadline on getting the language to the Elections Department. Did you have any other questions on that? We are expecting a record number of ballot measures from initiatives and from the state. So we were told, I don't know what the record is on how many questions are on there, but we're probably going to break it this year. So it's going to be a long ballot in November.
Thank you. The next we have is there's a draft resolution in here for discussion of regarding possibly joining our neighboring counties of El Paso and Douglas County in a lawsuit to overturn the state prohibition on coordination between local law enforcement and immigration authorities. That lawsuit's been filed with just El Paso and Douglas as the primaries. I don't know the status of it. I know there's probably some question on standing, but personally I think we should be joining, even if it goes no further than being kicked for standing, just to register the importance of the issue. So I don't know if you have anything more on that, Bart.
I have been in contact with the Douglas County Attorney's Office, spoken with them about this possibility, and I'm not sure there's necessarily anything new. It is fairly early on in the status of that litigation. I can find out exactly where that's at, but if the desire is to enter in regardless of the stage, I think I can clearly communicate that desire, and we can certainly see where it goes from there.
Okay, and then having talked with the Douglas County Commissioners, this is kind of any outside assistance they're footing the bill for. This is primarily being handled in-house by their attorneys, so there's no financial cost to us joining. But I don't know if you guys have any thoughts.
I'll speak in favor of the resolution. I believe it's a worthy effort to have the state tell local law enforcement to ignore any kind of specific illegal activity. Seems absurd to me. Our local folks should be able to pursue illegal activity wherever they find it and work with the appropriate agency when they find that. So I am in favor of this resolution.
I am also in favor of this resolution.
Okay, thanks. And I talked to our county sheriff last week about this. He's supportive of it as well. So I'm not sure of the timing of things. As you said, there's haven't been any updates, but if there is no objection, I think we could take this to action today.
Mr. Chairman, I move that we take this, let me read it here, resolution directing the county attorney to join the neighboring counties in a legal action to permit the county to fully cooperate with federal enforcement authorities. I so move.
Second.
Okay, we have a motion and a second. Any actually public input on this? Okay, seeing none, any final discussion? No, I think we've made our kind of positions clear. So all in favor, please say aye.
Aye.
Aye. Motion carries. So Bart, you have your instructions. And the second we have is a bit pressing in time, as there's only 15 days left of the legislative session, and we're kind of in the, I would say, the red zone, where we're going to see what the real priorities of the legislature are, and we're likely to see some things kind of hastened through and kind of not well considered. So this is a resolution regarding opposition to House Bill 241460, which has a good sounding title but not great content, really providing opportunities, causes of action to sue our local law enforcement folks over even allegations of misconduct that may clearly not be misconduct but not reported as such. It's, I guess I'll stop there and ask if, Dallas, I think you had some.
Yeah, I just had a couple
Comments
comments
on
on
these?
this bill that it seemed kind of punitive toward law enforcement. Part of the bill, as Commissioner Richardson just said, it allows for just allegations of misconduct to be a problem. And from sitting in as an elected position for quite a while now, we know there's a lot of allegations that get thrown out toward elected officials that either out of malice or ignorance that just aren't true. And I can only imagine what happens with law enforcement with some of the allegations that can come out of there. And the problem with this, it says even a peace officer who reasonably should know that one of his coworkers engage in such behavior could also get in trouble if they don't report it. And we all know that we have different ideas of what misconduct would be, but it's putting it in to be as a class 2 misdemeanor. And I looked up what that means. If you're convicted of a class 2 misdemeanor, it's up to 120 days in jail and or a $750 fine, which seems pretty punitive on this. Trying to, if someone doesn't even realize that there was a misconduct that took place, but someone rules that they should have, then they're not just their occupation is in jeopardy, but as is their freedom. And I think it's just one reason in this bill that we need to oppose this.
Thank you.
I agree with Dallas's summary.
Thanks. Yeah, and just for a little more info, this was introduced last Saturday. There's been no coordination with the State Sheriff's Association, law enforcement agencies, or any other associations that support local law enforcement. So the chance of getting something very wrong is very high when you rush stuff through at the end of the session. You know, nobody, including law enforcement, wants to see misconduct amongst law enforcement, but this is absolutely the wrong approach. Several years ago, they stripped our deputies of several immunities that they should still have. We've indemnified our own deputies as long as they're operating within policy and not actually committing a crime, and we've not seen that. But we saw quite a few folks after that last law pass leave law enforcement because they were going out risking their lives to protect our families at what became very much a high financial risk to themselves and their families. So quite a few folks chose retirement in our other fields of endeavor, both within the county and law enforcement in general. As a result of that, there's a lot fewer folks going into law enforcement, and as on the taxpayer side, law enforcement has become much more expensive because there's fewer of them and we're all competing for the same officers. And I think this has the potential of just adding another nail to that coffin and making law enforcement an even less desirable occupation. And it is a noble occupation, and folks just keep beating on them, and it's not right. So this one truly is very timely, and I would like to take it to action because the session will be over before we meet again. So I'd like to get this passed and in front of the legislator. It's not been assigned to a committee, or it had not been before we started the meeting this morning. So ideally, this is one that should just not be assigned in committee, not go any further this year. And if somebody wants to pursue it, they've got a whole bunch of time before next January to actually discuss it and figure out what it really means, what they're trying to do, and very likely find that this is all covered in other statutes. So with that, I would ask for a motion.
Mr. Chair, I'd like to make a motion in regards to, especially because of the timing involved with the General Assembly schedule, that we moved our opposition to House Bill HB 24-1460 to action, and that we ratify the resolution in opposition to House Bill HB 24-1460.
Second.
Okay, we have a motion and a second. Any public comment on this? Seeing none, all in favor, please say aye.
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 Aye. Motion carries. Okay, moving on to our planned action items. I know everybody's been waiting for this one. It is consideration of the April 10th, 2024 minutes.
Mr. Chairman, I move we approve the April 10th, 2024 minutes and dispense with the reading of those minutes.
Second.
Okay, we have a motion and a second to adopt the minutes of our last meeting and dispense with the reading. All in favor, please say aye.
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 Aye. Motion carries. Next, we have a proclamation recognizing this week of April 21st to 27th as Crime Victims' Rights Week. I know we had hoped to have one of our victims advocates here today to recognize them as well, but as I understand, they're actually out there, unfortunately, doing their job today. So I would like to just read the proclamation that was provided, and we'll get this over to them. But it reads, recognizing April 21st to 27th, 2024 as Crime Victims' Rights Week. Whereas in 1982, the President's Task Force on Victims of Crime envisioned a national commitment to a more equitable and supported response to victims. And whereas Crime Victims' Rights Act was passed in Colorado and at the federal level, guaranteeing victims the right to meaningfully participate and use their voice in the criminal justice process. And whereas surviving a crime can have a myriad lasting effects on victims, including physical, psychological, social, and financial issues. And whereas we know that countless survivors never tell anyone what happened to them. And whereas each of us has a moral responsibility to actively participate in the healing of others. And whereas it is necessary to create safe environments for the survivors of crime, providing not only support but also access to critical services and above all hope. And whereas victim service providers, community members, businesses, places of worship, colleagues, neighbors, and family members are capable of providing victim-centered, trauma-informed, and culturally responsive support. And whereas we must listen to the survivors and be willing to create new options for support to ensure that all victims of crime can receive help and seek justice. And whereas National Crime Victims Week encourages all people to ask themselves the question, how would you help a victim of crime? Now therefore be it resolved that the Elbert County Board of County Commissioners hereby proclaims April 21st to 27th, 2024 as National Crime Victims Week in Elbert County, Colorado. I would accept a motion to publish this proclamation.
Mr. Chair, I make a motion that we ratify the proclamation recognizing April 21st to 27th, 2024 as Crime Victims' Rights Week.
Second.
Okay, we have a motion and a second to ratify this proclamation. All in favor, please say aye.
Aye.
Aye. Motion carries. Alrighty, that was the end of our planned action. Board planning, I guess. Yep. Oh, yes, it does not end what we have on our agenda. Thank you. We do have one more item, and that was an update to several appointments on our organizational resolution for the year. So, like I said, mostly a housekeeping item, but we're identifying a few new folks for our noxious weed control board, a few other changes within the county that we're catching up on. So,
Mr. Chairman, I move that we approve Resolution 24-01A, 2024 appointments and reappointments.
Second.
okay, I have a motion and a second to update the resolution for appointments and reappointments. All in favor, please say aye.
Aye.
Aye. Motion carries. Now we're done with our planned action items for the day. For our next board meeting, do you have anything you'd like to?
I do not.
Okay. Would ask just on discussion that let's just get a read of where we're at on the well monitoring contract. Okay. And I believe it's in place, but that gives us some time to find out what the details are with the lack of monitoring over the last several months. obviously we'll have our minutes. Is there anything else? Yeah, it's probably time to get just a progress report on where we're at with last year's audit and kind of preparation for next year's budget. So I guess that's enough to get us started. We do have a couple of items for land use at 1 p.m. today. The Alpine Ready Mix site development plan there is a request for that to be continued. So we'll be doing that, but no other action. And then there is a minor PUD amendment that's being brought forward for Kelly Air Park. So until then, we'll call it 10:08. We're in recess and we'll reconvene here at this location at 1 p.m. Thanks.